one is what has been the most rewarding moment in your journey as a nephrologist doctor?
One thing that was very, very rewarding and still remember is my first renal transplant at Stanley Medical College Hospital way
Okay.
back in 1984. That was the first transplant in a public hospital. It was a teacher's son who was, the father gave the kidney and he survived. And seeing a patient who was almost dying with those days with the dialysis and renal failure, coming back to normal was a great, memorable event in my life. I cherish that
Truly.
moment. This
Okay.
is your kidney does two works. It removes the excess water and also the waste products of uh, body metabolism. It can do only one, that is the water alone can remove and can come as urine. But still the waste products of the body metabolism may stay. And our body needs only 6 grams of salt. An average Indian, particularly Tamilian and Andhra people, use 20 grams of salt.
Three
Normally.
times higher than the
So many. I want that particular biryani.
breast.
So biryani can use salt, oil, and lot of masala. And India is called as the diabetic capital.
Kidney stone always require surgery.
No,
Natural juices can replace water intake.
no, water is water. Nothing can replace water. Simple lifestyle steps. What we told you, lifestyle. Drink water, enough water. Water is the best detox agent for our body. Eat balanced diet, regular exercise, stop smoking, maintain healthy weight, and if you have BP or sugar, and you keep it under control, the long-term outcome will be prevented, at least stopped, if we don't keep them under control. These are the certain simple mantras in life all of us can follow. Keep your weight under. That's very important.
Very, very good day, everyone. And today we have a very, very special guest with us. And it's absolutely honor and privilege for us to host someone very, very special. We are delighted to welcome back for the third time our esteemed guest, Dr. Muthujayaram, highly respected and renewed nephrologist. With over 30 years of rich experience as a senior consultant, Doctor has touched countless life, not just through treatment, but through compassion. What makes this even more special is how patients often describe doctor approach as caring and reassuring as a family member. In fact, one of our previous viewer in the previous video which we had a dialogue with the doctor has beautifully portrayed this expression called motherly advice. So always, doctor gives very very motherly advice, which helps the patients so immensely, and that truly speaks volumes. And we are so honored. And currently practicing at Curie CURI Robotic Hospital, doctor continues to contribute immensely to patient care and medical awareness. We are confident that today's session will bring a lot of clarity, scientific insights, and practical guidance for everyone watching. Doctor, once again, it is honor for us to invite you and pleasure to have you with us. Welcome, Doctor. So,
Thank you.
thank you so much. So, Doctor, just wanted to start off with the ice-breaking topic actually. So, one is what has been the most rewarding moment in your journey as a nephrologist, Doctor?
One thing that was very, very rewarding and still remember is my first renal transplant at Stanley Medical College Hospital way
Okay.
back in 1984. That was the first transplant in a public hospital. It was a teacher's son who was the father gave the kidney and he survived. And seeing a patient who was almost dying with those days with the dialysis and renal failure, coming back to normal was a great, memorable event in my life. I cherish
Truly,
that moment.
absolutely, doctor. It's really, really cherishable, doctor. What is one misconception about kidney health you wish people to understand better and follow it, doctor?
One misconception is that people think that if they pass urine normally, their kidneys are healthy. Absolutely, you cannot take it's a misconception because you can pass urine normally, but still you will have kidney disease. This
Okay.
is your kidney does two works. It removes the excess water and also the waste products of uh, body metabolism. It can do only one, that is the water alone can remove and can come as urine, but still the waste products of the body metabolism may stay and the kidney disease will be there. So just because you are passing urine, well, that doesn't mean your kidneys are healthy. You should remember other look for the other symptoms.
Excellent, excellent answer, doctor. So now we have a follow-up question. What are the early warning signs of kidney problem that people usually tend to ignore, doctor?
Pardon?
What are the early warning signs of
Early.
kidney problem which people tend to ignore and take things for granted and so on?
The early symptoms of kidney disease is when you get up in the morning, you see the face puffy on at the mirror, and you ignore it as, "Oh, probably my sleep was not all right and all that," and they ignore that. That is one of the early warning. Then when you travel, you develop swelling in the leg and come back home and it become all right. That is also is a warning signal, but people ignore that. Third is when you have uh, tiredness, weakness, because of anemia is one of the symptom of one of the feature of kidney disease. And if they may not know that they feel tired, unusually tired in the days, and they say, I don't know, it's overwork and something like that. They ignore that. Fourth is sometimes loss of appetite and some kind of feeling in the tongue due to the ammonia in being excreted. The, the taste is gone. And then the skin may become dry. But don't think all dry skins are due to kidney problem. But the skin will become very dry and itchy. These are some of the early symptoms which people may ignore as part of the various other problems. Early symptoms.
Excellent, doctor. How often should a healthy individual to get the kidney being tested, whether my kidney is working normally or not? How to test it, doctor?
So what happens, when we see a lot of that time people, young adults, when they go for job and all, when they see it, they do the checkup and they send the patient, no, you are not fit because your BP is high, your urine shows protein in the urine. That is one of the reason people come to us very early in the disease. Otherwise, young adults, we they unless they go for job and the election, they don't go for any medical. Even if I tell that people, they have a lot of misconception about doctors and business and all that. So think that this doctor wants to do all this because they want to make money like that. It's not this. But when you are above 40, even if you have no symptoms, it's better to have an annual checkup like most health checkup. But if you are a diabetic, high blood pressure patient, you should have every year your kidney test has to be done. Particularly just two tests. That's a creatinine, which shows EGFR, and urine for proteinuria. These two tests, they are positive, you must become alert that you have a kidney problem.
Excellent, doctor. So, and people tend to ignore these things. Actually, after seeing this one, definitely they will, after 40, especially after 40, definitely they will take this test so to
Yeah.
ensure that kidney is healthy. Is high blood pressure more dangerous for kidney or the heart, or both it affects, doctor? The blood pressure, high blood pressure?
High blood pressure as well as diabetes,
Ah, yes, yes.
both are bad. If we ignore them, they both will affect the kidney, heart, eyes, and all that.
Okay.
So both should not be ignored and must be taken care of.
How does diabetes gradually damage the kidney if left uncontrolled and unnoticed and all that?
What happens when the patient has high blood sugars in their blood? It is being excreted in the urine. So the kidney has, when the sugar goes out of into the urine, it tracks water also. So they develop lot, they pass lot of urine. And for this, the load of extra sugar to be treated, the kidney becomes bigger. It's a larger, and each unit of the kidney is called a nephron. The glomerulus become larger. And as it goes on doing that, if you don't control the sugar, the glomerular part gets thickened, and that is the early structural change in the kidney. And patient develops protein in the microproteinuria, microalbuminuria, earliest sign, and slowly it increases. That is the uncontrolled. But this is the stage you can prevent it by controlling the blood sugar. And tight control of the blood sugar as well as BP can prevent these changes from the. But if you leave it on, it progresses to kidney failure.
Okay, doctor. So we should follow this one. Are the young adults today at higher risk of kidney issues due to mainly lifestyle changes, doctor?
That's what we find more and more what we call CKD, chronic kidney disease, the younger population. They are prone for the genetic disease and the immunological problems and all that. Besides that, the lifestyle changes increases the kidney disease in this patient only because of the eating habits. They eat lot of processed food and they contain lot of salt and also high protein diets. They go for the gym and eat protein diets with 1/2 kilo of chicken and butter, a lot of salt, and high protein diet are wheat. And they have the whey protein powders in the gym. They want to develop their muscles. All this can affect the kidney. But this increases the muscle mass, and you may develop, they may develop problems, and also increase the creatinine production, which is not handled by the kidney. So lifestyle definitely uh, affects the kidney, particularly you see more and more young people develop kidney disease. One is this protein intake, they want to change, and eating a lot of processed food like pizzas and other things, are very commonly eaten by them. They contain a lot of salt, fat, and everything. And you can call them as salt mines. And our body needs only 6 grams of salt.
Yes.
An average Indian, particularly Tamilian and Andhra people, use 20 grams of salt
Three
normally.
times higher than the
So
present.
many, so much. Our need is only 6 grams. That is why so much of diabetes and hypertension common. More in a, it's difficult to control. And similarly, the when they eat this, they eat a lot of sugary drinks, all the artificial drinks that you drink along with the food. And this too increases the insulin resistance. So even the normal insulin is not able to function properly because of this various lifestyle changes and sedentary job, particularly IT people, they sit in one place and never move out. And they put on weight and there's no exercise and the obesity comes in them. Obesity per se will affect the if
Mm.
you're overweight, that itself can affect the. So lifestyle makes a lot of uh, kidney problems and more chronic kidney disease we see in youngsters nowadays.
Very well said, doctor. We should follow these guidelines. And can stress and anxiety indirectly impact the kidney, doctor?
But
Anxiety, stress, tension,
for
all that.
sure, all that definitely because anxiety and stress are one of the two things that you lose your sleep and your BP goes up and you don't eat properly. All this can affect the kidney. Already affected kidney may get worse. So they play a great part. It's better to be calm, learn to be calm, accept things as they are, and a little more philosophical in life will help a long way to keep working in good health.
Yes. So beautifully said that, Doctor. The reason why I picked up this question is that now in IT many layoffs have been happening, and because of the AI and geographical tensions around us, so people are really very desperate to get the job. That's for sure. At the same time, their anxiety goes up and the tension goes up, and even the talented people, their the confidence level go down, and so on, right? This is one extra question I really wanted to put forward to you, doctor. So even in sometime life gives difficult tests, and some people do take it positively, and then they get a better job and go on, but large people, they get dejected and they go out of the track and whole things get changed. And if that person who is earning the money gets into trouble, the whole family gets into trouble, right? So any advice from you, doctor, please?
So I think it's a big problem for particularly youngsters who are in a very good job and made money, suddenly go out of job for him and for the family. They are used to a better life, better comfortable life. They have to come down. There's a lot of anxiety amongst them whether they get a job or not, and sleeplessness. And they don't sleep well. And if you don't sleep well, that affects your kidney again, as one of the questions say, that sleeping is essential. Because when you sleep well, your kidney takes rest. It's called a circadian rhythm. There is an internal clock in the kidney that's called
Okay.
circadian rhythm. So daytime it works very well. Night it takes little easy. That's the time what should I say, refreshes itself and takes less work. But if you don't sleep, that gets activated. And if you get tense, and again that is activated, and stress hormones are secreted, and that increases your blood pressure, and your normally at night our BP goes down. That's called nocturnal dip. But if that dip goes away, so persistently your body is exposed to high blood pressure. So people, these all kids, young boys and girls, must be counseled how to face failure, or I won't call it a failure, a setback in their life, how to face it, how to overcome it. Good counseling is important. Otherwise, besides all the things, their pressure may go up. And if they eat wrongly, even the diabetes, nowadays, why the diabetes and hypertension comes very early is because of the wrong kind of food they eat. Lot of sugar, sweets. When you go to somebody's place, you take sweets to see them. So I used to tell my patient, including you, I used to that take fruits or vegetables to them, not sweets. But that is a habit we all have that increases the diabetic state. And the pickle and pasta we eat contains a lot of salt. Besides this modern food like pizza and where the cheese and all are used highly, a lot of salt. The over salting your system is affect your kidney, blood pressure. In the long run, it's not good for the kidney.
Well, very well said, doctor.
You have to counsel this youngsters. I don't know. The
Correct.
company which is throws them out must at least appoint a counselor and tell them that things will get back now.
Correct.
Soon, I
Very
hope.
yes, doctor, very doctor.
All of us
And
are affected also by the war and other things,
correct.
isn't it?
Yes, very well said, doctor. So patient and family, actually, what happens actually, a patient has a diagnosed, unfortunately, with the CKD stage and all that, right? What they do, they just keep changing the doctor and all that, right? Oh, this doctor, and confuse, and hospital to hospital, doctor to doctors. And I know one of the thing is that, so they don't trust the doctor, and the doctor also doesn't get time to read the patients carefully, because actually they think that actually doctor is making money, but doctor is trying to identify and go to the root cause so that the doctor can fix the problem, right? So often we have seen that, this is also a pattern that, when somebody comes with any issues, whether it's kidney or heart and all that, so they, one of the suggestion people always get bombardment with is that, okay, go to the next doctor, the other doctor, or other hospital and all that, right? So sometime what happen actually, though these changes do adversely affect the patient, and if the patient would have been continued with the same track and all that, they could have made it better, but the story becomes vice versa. So what advice you have, doctor? So do we need to stick to a doctor, believe doctor, and then keep going, or I think second opinion once a while is fine, or how it is, doctor? So slightly controversial,
It,
but I
it
just want to.
happens all the time to me because I'm the senior most doctor now, one of
Correct.
the senior. So people come with 10 files now,
Yes.
going to different doctors and asking, and people don't like to hear they have a kidney disease or kidney function is poor. They don't want to hear that. They don't want to accept that. So they move on. It takes really, I don't see a patient with single file coming first to me because I happen to be the senior most person. All come with this. So once I asked the patient, he came with, he seen all the doctors in Chennai and came to me. And I asked, why did you come to me? He said, oh, you are the senior most. So I thought you will. He said, the disease will have a same kind of treatment is not going to change because I'm a senior. Experience is different, but
Correct.
medications are somewhat different. Then I asked him, what are you going to do? I'm going to Singapore to see you.
Again,
Show
there is
me
a
case.
change.
That's what he told me. That is the kind of people now. When they have a lot of money, they move on to various doctors. But doesn't help much. You have to understand at some stage they have to accept they have a kidney disease and to have faith in the doctor. Most of us, we don't unnecessarily do tests, unnecessarily give medicine. Most of us, by and large, I mean, you can tell so many examples otherwise. But have a faith in your doctor and follow that advice. And they go on to the 10 doctors. At the end of the day, they go to the alternative medicines. Siddha, Ayurveda. They never say that you have a kidney problem will not be. What we say is most of the kidney problems will be controlled completely like a typhoid fever or pneumonia, which can be treated and you can go home. It can be controlled and followed up, and you can live longer with the restrictions of in your life. But many of them don't accept it, and they move on to from doctor to doctor. And I don't know how to tell them that.
Yes.
I tell them that don't waste your money for everywhere you have to go. And the habit is if you are in a different hospital, you have to do the investigation in that hospital. There are certain couples
Correct.
that are there. So you'll be repeating the same test again and again in various hospitals. And you're paying. But people I don't understand. They don't want to have kidney disease. I understand, I agree with them. But when it comes, you have to accept and know how to manage it. Very, very
True. Very well said.
discipline is the most important in
Mm.
in arresting the progression of your disease. And have faith in your doctor, and then follow your follow the treatment.
Absolutely. Well, very well said. Beautifully said, doctor, actually. So, when does a patient actually need dialysis? And then, actually, dialysis has to be a permanent requirement and all that, doctor. So,
There are two kinds of kidney failure. One is acute renal failure. Suddenly the kidney fails due to various reasons, severe infections, During COVID period, we had a lot of renal failure patients. Sudden onset of it. Those patients need dialysis for few days, fewer, and most of them recover. At least they recover to a non-dialysis stage. They become chronic kidney disease. They can be managed. But there is a chronic kidney disease progresses on to stage 5, ESRD, end stage renal disease, because the renal dysfunction is divided into 5 stages according to the GFR. GFR is the basic test of kidney function, and that can be calculated. We call it the eGFR, and now everybody, even your creatinine may not go up, but your eGFR comes down. That means your kidneys are getting affected. So that stage from 1 to 5, if you move on, you need dialysis. That's called end-stage renal failure, and that's called chronic maintenance dialysis. They can go for hemodialysis, they can go for peritoneal dialysis. That's a different section to talk. So
Correct.
that we can discuss. So dialysis is not at all. People can live. There are people with me who are living with dialysis more than 10, 15 years. But with the dialysis, as you go on, you may not become better than what you are. But with the transplant, it almost the reverse. With the transplant, you almost live a normal person. This is called renal replacement therapy, RR. And one is dialysis, another one is transplant. So that's a different section we can. Whereas dialysis can be acute renal failure, they recover. But 10% of our dialysis patients are like that. But majority of them are end-stage renal failure due to chronic kidney disease. The commonest causes are two: diabetes, hypertension,
It's okay.
and glomerulonephritis, immunological diseases are other.
Okay, okay, doctor. So, what are the common complications associated with the long-term dialysis, doctor, like such an infection, catheteral related issue, hemoglobin gets imbalance, and so on?
So when we do dialysis through catheters, we have okay, a short-term catheters are there that we can't keep it more than 4 weeks. By the time we start putting them, what's called AV fistula. That develop. That's a long-term dialysis that usually don't have any infection. But when the catheter is in the neck, it's likely to get infection. But there's a new catheter called perm catheter that can be kept for a year. That also you have to be very careful. Both the dialysis unit as well as the patient has to be careful to prevent infection. Without infection, if they follow, diet restrictions are very minimal. But even then, our patients, when you tell them you can eat non-veg and you can eat protein, they're not happy. I want that particular biryani. So biryani can use salt, oil, and lot of masala. So that kind of, and if they can, you'll be fairly normal life with the dialysis. And the other alternative is the transplant.
So, follow-up question on dialysis, doctor. So, what are the precautions, although dialysis is on, and what are the precautions and lifestyle habit people should follow, doctor, to avoid complication and infections? What we discussed.
Dialysis, if you are doing through fistula or this thing, you have to be regular in your dialysis. When we tell them thrice weekly dialysis, you shouldn't miss the dialysis. You
Oh,
miss, you become symptomatic. Very often they say, today I couldn't come, my people didn't bring me in, and I went for this function at home and all that. You shouldn't miss your routine. If you miss the dialysis, you will again develop the same symptoms. That's the one thing. Be regular in dialysis. And most of the restrictions are reduced. The salt intake can be, but not the original 20 grams salt which
yes,
we
yes.
you
6
can
gram
go
will
back,
remain 6 gram. Okay.
you can go back to 6 gram or 5 gram diet, salt diet. Take proteins like non-veg, egg, and other things. You have to take more protein. But if you are not on dialysis, you have to restrict the protein to 20 grams a day end stage. But once the protein with the dialysis, you can increase to 40 to 45 grams a day. And you can take most of them, but we usually tell them avoid mutton. Because they contains a lot of uric acid, oxalates, salts in mutton, and fat content is high. You all know. So usually tell them avoid, but once in a while you can do that.
Okay. So thank you so much, Doctor. So one follow-up questions on how to increase the hemoglobin and decrease the urea, Doctor. So what are the what are the advice you have naturally to boost the the hemoglobin and reduce the urea?
Anemia, the hemoglobin, low hemoglobin is called anemia. It's part of the disease. That is
Okay.
because kidney produces a hormone called erythropoietin. And once the kidney shrinks, that protein erythropoietin is not produced. And their food intake is also less due to the restriction. So they become very anemic. But that can be corrected by giving regularly this erythropoietin injection along with iron. During dialysis, we give iron and intravenously once a month or once in 15 days, according to the need of the patient. The erythropoietin can be given once a week. And the goal is to keep the hemoglobin around 11 grams. The patient will feel perfectly all right with that.
Excellent, Doctor. So now we have a very exciting chapter, Doctor. This I did not include in the previous one, called rapid fire, myth
Oh,
or reality. I'm going to give a statement, Doctor. So you please let us know whether it is a myth or
yes or
reality.
no? Only yes or no?
Yes or no? Or you if you wish to elaborate, you can elaborate, Doctor. So there are 10 questions I have, Doctor. So one is that I think you in the beginning you did say this one. Clear urine always means healthy kidney.
Sorry, what?
The statement is clear urine output always means healthy kidney.
No.
Okay. Skipping meals helps detox the kidney. Skipping the meal helps to detox the kidney.
Keeping the meal. What is that?
Skipping the meal, like skipping the lunch or skipping the dinner,
No,
does it help
skipping,
to
skipping. No, no.
yeah?
It will never detox anything.
This is a common misconception people have actually.
Don't
So
miss your food and
uh,
eat less frequently. That is
okay,
the mantra.
okay, okay, doctor. Energy drinks are harmless if taken occasionally.
Which one?
Energy drinks are harmless if taken occasionally.
It is harmless, but occasionally you can take it. But usually that becomes once occasional become regular later on. So
True,
it is
true,
not needed. If you
correct.
want, you can take it. I don't know whether it gives energy and all that. May replace your salt. Usually they contain glucose and
Yes.
sodium, potassium salts, which are no need to be taken separately.
Okay, okay, doctor. So well said, doctor. So only diabetes need to worry about kidney disease.
Diabetic patients.
Yes.
Yeah, definitely. Because 40% of our dialysis patients are due to diabetes. And diabetes is the common cause, and India is called as the diabetic capital.
My goodness.
Almost now you see, uh, even from your place, you can see not a house is there without a diabetic patient. That is because of our ignorance and also the habits of we have become richer, the food become very richer,
Well,
and all that. One of the reasons the lifestyle, as I told you, is early onset diabetes. Usually in the earlier days, type 2 diabetes comes around 50 years. Now we see them at 35, 40 years. So diabetes is the common cause of renal failure.
okay.
Next is diabetic hypertension and other kidney diseases.
Okay. Kidney stone always require surgery. Okay.
These stones smaller than 8 millimeter can be treated with medicine and diet. The diet contains uric acid, oxalates, and those things can be avoided. Take a lot of water. Drinking water, you can call it detoxify your system. is one of the important habits, particularly stone people take 3 to 4 liters of water. And only if the stone is left bigger, it becomes bigger and bigger, 8 to 10 or 1 centimeter more. It needs surgery. It can be broken or it can be surgically.
Okay. Dark color urine is always a sign of kidney disease. Dark color urine.
Yeah. Dark means it is reddish dark, it is definitely kidney disease.
Okay.
Sometimes when you don't take water enough, you become dark yellow, concentrated urine. You don't take water enough, little urine. That may not be due to, but if you drink a lot of water, it becomes okay. Yellow urine always jaundice. But otherwise, dark means reddish, it is kidney problem.
Fitness supplements are completely safe if widely used.
Fitness?
Fitness supplements are okay to take.
No.
Okay. So if you're fine, your kidney must also be fine.
No, no, not necessarily that. Kidney disease can be a silent killer, very
Okay.
often. It can
Okay.
be silent and undiagnosed, and it may go on like that. And so it's not okay.
Okay. Good, doctor. Natural juices can replace water intake.
No, water is water. Nothing can replace water. Particularly nowadays we get RO waters with minerals are removed. Natural juices contain a lot of potassium, and if you have kidney disease, you cannot take it. And they contain sugar and also not advice. But you can take once in a way, but not it cannot replace water. Never ever.
Excellent, doctor. So, one last question on the rapid fire is that frequent urination always indicate kidney problem. True or
Frequent.
false? Frequent urination always indicates kidney
It
problem.
could be due to kidney means kidney is there and then the tract is there, ureters and bladder. Frequency can increase in bladder problem due to bladder problems. That's called overactive bladder. Due to prostate or stone obstruction. So it mainly it may not be the kidney, the whole tract, kidney, ureter, bladder, and the prostate. Any of those conditions can produce frequency in the urine.
Okay. So now five more questions are related to current trends and lifestyle, doctor. What is your view on detox diet? Detox diet, and does it cleanse the kidney? Does it clean the kidney and all that? There
No.
is something called detox diet that
There is
people tend
no, only water can be detox your kidney.
to.
Nothing else. There is no detox diet. There is no such things as that.
Okay, okay. Are wearable health devices actually helpful in monitoring the kidney related one, like BP, steps, and all that?
Sure.
So,
BP monitor, how much steps you do that. Tells you're active. You have to be very active physically. BP monitor, if you are a high BP patient, suddenly you feel giddy or something, it may be low BP or high BP. So it's no harm in wearing that. It helps. Particularly people are very paranoid. I mean, in the sense they always worry, I will die. In the family, something happened, I will die, I have a heart attack, I have this. Nobody worries about kidney. But
yes,
very often they worry about heart attack. So it's a good device. And also tells how much exercise you are doing. If you're supposed to do 7 to 10,000 steps a day, and normally. And so that will make you motivate you if you've done only 3,000. Oh, I did less. So I have to do more. Motivation is good.
okay, okay, doctor.
Anyway, a lot of people wear that, and I find that they want to keep up the need of steps.
Excellent.
It's good.
Okay, excellent, doctor. So one last question on the current trend and lifestyle is about the junk food and the risk of having the packaged food, everything, doctor. So, what are the health implication we have with the packet foods and junk foods and so on, doctor? How one must be very careful and stay away.
So most of the packaged and junk food contain a lot of salt. Actually, they are actually called as salt mines. First, salt is a preservative, not only for taste, but for junk food, carry from here and there, and all tin food and all contain a lot of salt. So it's better to avoid that. And preserved food, like tin food and all that, tin food and a lot of, they contain a lot of salt. Junk food, I told you, they contain all kinds of things, lot of
Yes.
fat, lot of salt. Cheese and all has lot of salt, and most of the junk food contains these things only. So I think I will strongly advise. I don't know whether people will listen to me. Advise
People,
against
our
all.
subscriber always do watch everything, and many people do take this your feedbacks and the knowledge being taken very seriously and on that. So I am having a good trust on 11,000 subscribers who are there, and they definitely will follow doctor.
I
So
hope if they do it, I will be the most happiest person. I will
yes,
something to the community at large
correct,
with my
correct.
knowledge and education. They do it, they listen to us, so avoid of those all of these. And now the petrol, gas has come, all the junk food units are
Skyrocket.
closed. They are taking home food. I think that will reduce the BP and all for people. That's a good.
Yes, yes. So this is closing note. So what are the golden tips you wanted to share, doctor? So what are the golden tips to keep the healthy kidney as well as the overall well-being, doctor?
Can you just put the slide
Yeah.
on?
Yes, yes,
I want them to remember that.
yes, yes, doctor.
Simple lifestyle steps. What we told you, lifestyle. Drink water, enough water. Water is the best detox agent for our body. Eat balanced diet, regular exercise, stop smoking, maintain healthy weight, and if you have BP or sugar, and you keep it under control, the long-term outcome will be prevented, at least stopped, if we don't keep them under control. These are the certain simple mantras in life all of us can follow. Keep your weight under. That's very important.
Excellent, excellent, doctor.
Reduce the
So
salt in your diet.
that's a very important point, doctor.
Another important for us.
Yes, yes, yes. Thank you so much, Doctor. As we come to the end of the incredible, insightful session, Doctor, I would like to sincerely thank you for taking your time to share the knowledge and experience and valuable guidance with all of us, Doctor. Today's discussion has not only increased the awareness, but also increased the clear many doubts, like particularly myth and all that doubts being clear with a strong scientific foundation. I'm sure that our viewers now have a better understanding of how to take the kidney health and overall well-being. On behalf of the entire Abrar Knowledge Channel, so entire audience, we truly appreciate your continuous support in spreading the awareness and educating this community. To the viewers, if you found this helpful, please do comment. So once again, thank you so much, doctors, from bottom of my heart, and it's absolutely honor having you with us, doctor. Until next time, please stay informed and stay healthy and take care. So thank you so much, doctor. So your
Thank
closing note,
you.
doctor.
Thank you. Thank you very much for the opportunity.